Hi, I'm Dr. Garni Barkhoudarian, and I'm the director of the Pacific Hydrocephalus and CSF Center at Pacific Neuroscience Institute. And this is a PNI Minute. Let's talk about normal pressure hydrocephalus. This is one of the few reversible causes of dementia. It's really important to identify these types of causes because you can really help a patient out as opposed to going down the road of Alzheimer's disease or other irreversible types of dementia. In normal pressure hydrocephalus, the fluid-filled spaces of the brain, or the ventricles, are enlarged. The ventricles are constantly producing the fluid that bathes the inside of the brain, and then it actually goes out to the outside of the brain and allows the brain to kind of float in fluid. And in this situation, the ventricles are producing too much fluid. The reason it's called normal pressure hydrocephalus is because we also have high pressure hydrocephalus and low pressure hydrocephalus. But the high pressure hydrocephalus are the ones that we typically see after brain trauma or infection or bleeding in the brain. Normal pressure hydrocephalus, however, happens as people get older. It's more a dysfunction of the absorption of fluid back into the bloodstream and not really necessarily related to a single incident that may have triggered it, like an infection or bleed. When we do certain testing to make sure that this is related to their symptoms, it can improve their memory, improve their walking, particularly a very specific type of walking problem called the magnetic gait or apraxia. And it also can improve urinary incontinence. So those three things are kind of the triad of normal pressure hydrocephalus. We are working with cutting edge technology. In some cases can treat this endoscopically, but the majority of cases we're treating these with new types of ventriculoperitoneal shunt technology that allows us not only to treat the problem well, but also minimize some of the downsides of it, some of the side effects that we see from placing these shunts in. I think there's a lot of new technology that's still on the horizon for this condition that's been known for 5 decades or more. We have a multidisciplinary team here to help us determine if the patient does indeed have normal pressure hydrocephalus. And once we meet the proper diagnostic criteria, then we know that the patient might benefit from a shunt, and then we proceed. The treatment is to put a shunt in. The way we put in a shunt is we put a catheter into the ventricle and we literally let it drain fluid out down into the abdomen or other parts of the body that help absorb the fluid and take it back into the bloodstream. And that helps decrease the pressure and decrease the volume in the brain, and that allows for the patient's symptoms to slowly get better over time. So typically, shunt surgeries are done with an overnight stay. The surgery itself takes about an hour, and the patients are up eating breakfast the next morning and usually out of the hospital, or they might need to go to rehab to get their strength back up after this whole ordeal that they've been through. In the last couple of years, we were a participating center in the National PENS trial for normal pressure hydrocephalus. This was a multi-institutional trial over 25 sites led by Johns Hopkins to evaluate whether shunts can actually help normal pressure hydrocephalus. The results put to rest the decades-long discussion and found that there was definitive benefit to patients with normal pressure hydrocephalus. It's a really well-tolerated procedure and patients do quite well, but we do need to monitor our patients pretty closely for a number of months afterwards just to make sure that we're draining properly, the shunt is set to the right setting, and we use a special magnet to adjust the shunt setting for them, and then also make sure that they're not developing any complications.